Welcome back. Well, in an emergency situation, it could just be that a hospital may not be the most affordable or fastest place to go for help. The difference between the ER and urgent care in my Watching Out For You report. The hospital is often the first place we think of in an emergency situation, but it's important to know there's an alternative that could save you some serious cash and time. There are almost 30 urgent care facilities in the Treasure Valley that can provide stitches and x-rays and other medical help if you're hurt or sick.
It's for those types of illnesses or sprains or simple fractures or simple lacerations in which can be addressed in an urgent care setting.
Even doctors at hospitals recommend urgent care facilities.
So you're saying if there's a small laceration or a cold, you should choose the urgent care over a hospital?
Absolutely. It's going to be far less expensive to receive care in that right setting and at a right price. And I think even insurance companies prefer you to go to the urgent care center when you possibly can.
Looking at the numbers, an emergency room visit could cost you hundreds of dollars more than a trip to an urgent care. Debt.org reports going to an ER will set you back $400 for an earache, but going to an urgent care facility for the same issue will cost you just $110. For a sore throat, an ER will cost $525, compared to just $94 at an urgent care. And for an upper respiratory infection, you'll dole out $486, compared to $111 at an urgent care.
Why is there such a disparity in the prices? Why is it so much more expensive to go to an ER than an urgent care?
Well, emergency rooms are geared up to see the sickest people. The size, the equipment, the architecture, everything is, well, for our particular instance, it's a trauma center, and they're ready to see major trauma, and the price is in part set due to that.
And local doctors tell us that only 3 out of 10 people actually need that medical care attention the ER provides. So they say 70% of the people that go to the emergency room could go to urgent care instead.
If I'm someone who has a sore throat, whether I'm a child or an adult, that's not going to be best treated in the emergency room. I think we would all agree with that.
But some question the kind of care you'll get when outside the emergency room. But Dr. Brown, the Vice President and Chief Medical Officer of the St. Alphonsus Health System, says you'll either see a physician, physician assistant, or a nurse practitioner at both an ER and an urgent care. Wait times is also where you'll notice a big difference between the two. Dr. Peterman, the president and CEO of Primary Health, tells us from the time you check into a primary health urgent care to the time you check out, the average person will take just 44 minutes. And a spokesman for St. Al's says wait times are similar in their urgent care facilities. Patients wait an average of 1 hour, 18 minutes. But at a hospital, Dr. Brown says the wait time for a non-life-threatening issue could take hours.
Depending upon the time of day, it could be 4 and 5 hours or even perhaps more. And remember that the emergency room will triage patients based upon their illness. So people who come in sicker are going to be put to the front of the line regardless of when they arrive.
Ultimately, the decision is up to you, but it's important to know you have options when it comes to your health. And if you're not exactly sure where you should head if you need some medical attention, you can now figure that out with a free app. It's called iTriage. Just type your issue into the app or the iTriage website, and it will tell you whether you should go to an urgent care center or the ER. Interesting. For a link to that site, just head to KBOI2.com and click on News Links.